Go on to another focus area this month of October is Breast Cancer Awareness Month, and there's renewed focus on addressing the myths and fears attached to diagnosis and treatment. And having the right cover is also beneficial. And while early detection is the key to effective treatment, many barriers are hindering efforts, including fear around breast cancer screenings. And these include low income or worries about costs and a lack of awareness on breast cancer risks. To further unpack this, I'm joined by Gary Feldman, the Executive Head of Healthcare Consulting at NMG Benefits. Thank you so much for your time, Gary, and good afternoon to you. Just looking at the month of October, great focus has been on early detection and also demystifying some of the fears and stigmas or secrecy around breast cancer. What type of awareness programs are you running?
Good afternoon, Cindy, and good afternoon to the listeners. Thanks, Cindy. I think, as you mentioned, October is Breast Cancer Awareness Month, and I think it's from a public and a private sector perspective that we're trying to make people aware of breast cancer and basically what you can do to early detect and what you need to protect yourself and make sure that you get the right treatment if you have been diagnosed with breast cancer.
Yeah, we're not quite,
the most important thing.
Sorry, Gary, we're not quite there yet in terms of access to universal quality health care, and many may not be on medical aid. So the cost factor will come into play where people may have to prioritize other obligations as opposed to tending to their health. But the health aspect is very important.
Absolutely. I think if you don't have access to medical aid, I think self-breast examination regularly is critically important, because that is the first step to try and diagnose it as early as possible. And then also regular mammograms, and you can have regular mammograms at either private or a public facility to ensure that you detect it early. We know that the chance of survival, if it's detected at stage 1, is 90% plus, while if it's detected at stage 4, your chance of survival is only 25%. So early detection is the key point around breast cancer.
Yeah, and education as well. There is a lot of information just where you can empower yourself if you do suspect that there may be a abnormal breast tissue or some activity in your body. There will always be an indication that you need to go and seek professional healthcare advice. So how do we encourage people who may be fearful, where there isn't an open discussion, be it the hereditary nature of the cancer in the family, or even if that person has been diagnosed? What kind of empowerment tools are there?
I think that's important, Cindy, that people face this upfront and are open about it, to detect and go to their doctor, to engage with the doctor. As I said, unfortunately, there are many South Africans that don't have access to private healthcare. But the public healthcare environment, seek advice from a nurse if you do pick up anything as a lump in your breast. That is the first signal of potential breast cancer, is when you do a self-assessment and you do feel something that is not normal or natural. Seek advice. Don't be scared. Be open. Go and speak to either, as I said, a nurse at your public clinic, or seek advice from a doctor. And once that is detected, then the necessary steps can be taken to address it and basically to take corrective action.
Yeah, and to understand the different types of cancer as well, as you're saying, and that these would be mitigated by a particular treatment based on your condition. So it's not a given that you automatically would have to go into radiation or chemotherapy, which most people might be fearful of in terms of the treatment for breast cancer. Gary?
Yeah, Cindy, I think the important point that people must note, there are a couple of things that you can do to reduce the risk of having a breast cancer. And those are small things: is stop smoking, limit your alcohol intake, basically exercise regularly. And it doesn't have to be serious exercise, moderate exercise, basically, and also your diet. A fatty diet is not a good diet. And then always wear sunscreen when you go out into the sun, and ultimately manage your stress, because stress is also a huge initiator of cancer, not only breast cancer, but cancer overall.
Yeah.
And unfortunately, approximately 1 in 30 women will be diagnosed with breast cancer in their lifetime. So it's not something that is unheard of. and it's becoming, unfortunately, more and more frequent in our society.
Yeah, and do you think this is a change of lifestyle, or as you're saying, the high pressure that comes with modern day society, let alone just dealing with your day-to-day obligations, the cost of living, your obligations around, your children and school fees, etc. Do you think that is an added pressure to our quality of life because of the stresses that we face?
Absolutely. I think, as I said, and the previous presenter on your show also just said, stress is a killer. And ultimately also fast foods. I know we're all under pressure. We don't cook a healthy diet. We get fast foods, fatty foods. Those are all killers and basically drive the increase that we see in cancer overall, not only breast cancer, but cancer overall.
Okay, talk to us about the healthcare insurance options that one has, of course, depending on your means, on your affordability, Gary, primarily if one may suspect that there is a history in the family of cancer and you may need hospitalization or even surgery. What kind of packages are we looking for the different income groups?
Yeah, well, I think, Cindy, that's an important point. And we at NMG try and advise people that if you can at all afford it, at least get yourself a hospital plan so that any procedures in hospital are covered by a medical scheme, a registered medical scheme. And what we also find now is that with a lot of the biological drugs that oncologists are prescribing for radiation and for cancer treatment, the medical scheme doesn't cover that in full. And that's why we also then recommend that people consider taking out gap cover, because gap cover covers for the shortfalls that your medical scheme might not cover. So to ensure that you've got comprehensive cover to the best of your ability from affordability perspective is to see what you can afford. And that is where we can assist people and speak to a healthcare broker who can assist in identifying an affordable medical scheme that can give you cover for cancer and for the basic medication. Yes, comprehensive medical cover, unfortunately, has become unaffordable to a large percentage of the South African population, but you should try and get at least a hospital plan and making sure that you are covered when you need treatment in hospital, which you traditionally do need if you have been diagnosed with cancer, because you will have to have oncology treatment and potentially surgery, which all takes place in hospital.
No, Gary, I totally appreciate it. That's Gary Feldman, the Executive Head of Healthcare Consulting at NMG Benefits, allaying some fears that even according to your means, there is some form of medical cover that you can access, and especially if you might need hospitalization, that you may want to start with that particular cover.